Does sleep apnea run in families? I've always been curious about this.
Well, not specifically, but indirectly there can be a lot of, familial traits like a short chin or a thick neck or even obesity that certainly can play a role as to being very common to have sleep apnea in many generations in a particular family.
How does obesity affect
Well, it's one of the biggest risk factors. Certainly, obesity makes for the body to have a lot of different types of obstruction, particularly in the neck, a lot of tissues that collapse and cause obstruction of the airway. So obesity is the biggest risk factor for sleep apnea.
What about with children that you hear when they're little? It's such a cute sound. Everything is cute when you're a baby, right? But when they're little and you hear them snoring, does that mean they're going to snore when they're older? Because I hear it more in babies.
Well, in kids, it's purely anatomy. So small airways, small throats, but large tonsils, they're going to snore. Where in adults, we're adult anatomy, and now we're talking more of a weight issue, more obesity related to in adults.
All right, so when you snore, does it mean you're a snorer or that you have sleep apnea too?
So it's a great question. Snoring is a byproduct of vibration of tissues. So you don't have to have sleep apnea, but you can be snoring from vibration of tissues. If you have a stuffy nose, if you have a cold. But we worry about people who are loud snorers because they can have sleep apnea. That's when you stop hearing the snoring, and that's when there is an obstruction in the breathing. That's when the patient stops breathing. That's the area that we're main concerned about apnea.